In this presentation, we will explore depression from an integrative psychiatry perspective. In addition to this presentation, please check out the blog linked in the description, and there you'll find a downloadable document that provides some general considerations for depression from an integrative psychiatry perspective. Depression is a persistent, whole-person state of physical, psychological, and spiritual dysfunction marked by loss that impairs one's capacity to engage with life processes. This loss infuses several domains: interest, energy, meaning, motivation, sleep, appetite, focus, and thought content or perceptions. Metaphorically, it's like walking through a thick fog with weights on your legs. You can't see where you're going, and every step takes effort. The PHQ9 is a widespread screening tool for rating the severity of depressive symptoms. Tools like this one have the advantage of deriving an impression of how severe the symptoms are, which is more meaningful than merely identifying what symptoms are present or absent. The cutoffs for the degree of depression are listed here. Generally speaking, if the score is greater than 10, it may be beneficial to explore further investigation and treatment. DSM-5 diagnoses, such as major depressive disorder, bipolar depression, postpartum depression, and persistent depressive disorder, are descriptive in nature, meaning they are not explanatory, where there is no cause and effect relationship. To explore cause and effect relationships, we must look beyond these descriptive diagnoses and conduct an in-depth analysis of the nature of each part of the depressive experience and incorporate biomarkers through labs and diagnostics. In a separate presentation, I'll explore the problems of DSM-5 depression diagnosis. Metaphorically, if the tree represents our holistic experience of life processes, the leaves represent the symptoms. The trunk represents the organization of body systems and their functioning, ultimately influencing what the tree produces. At the base of the tree, we have core causes and contributing factors that are intimately related to the root causes. All of this interfaces with the external environment. In integrative psychiatry, we stop sorting through the leaves and get to the root, while appreciating the interrelated nature of these elements. As part of the analysis of specific elements of the experience, i.e. the symptoms, environmental contributions are included. I developed the acronym WELLNESS to capture the primary domains of lifestyle and environmental considerations to explore in the context of individual experiences. These domains, namely relationships, leisure, labor, nutrition, exercise, sleep, substance use and other addictions, and spiritual practices, are all interfaces that illuminate our experiences. While this acronym captures the domains on a superficial level, the integrative psychiatry specialist will move in the direction of depth to further tease out the nuances of these domains to explore their influence on your experiences. Overall, the goal is to balance these domains. An often neglected area of investigation in psychiatry is the influence of ancillary body systems. I describe these as axes that bidirectionally interact with the brain. Here I've developed an additional acronym, HPA-GGTIME, to capture some of the main axes critical for exploration. This investigation includes the adrenal glands governing the stress response, the hormonal environment, gut and detoxification, thyroid and metabolics, immune system, micronutrient environment, and epigenetic influences. This investigation is supported through the use of advanced laboratory and diagnostic studies. These changes in the internal and external environment and the nervous system bidirectionally rewire each other to sustain an experiential state, eventually converting it into a trait. The nervous system will then respond to the environment in a consistent way based on these changes, owing to the diversity and persistence of symptoms. Conventionally, neurotransmitters become the target for treatment when considering pharmaceutical agents. Neurotransmitters are chemical messengers that carry a signal between neurons and ultimately brain regions. Neurotransmitters targeted in the context of depression include serotonin, dopamine, and norepinephrine. Changing the activity of these messengers is linked with improvement in symptoms, but we've discovered that activity of neurotransmitters is not the cause of depression. In fact, there is no link between depression and specific neurotransmitters, as confirmed by a recent study. So to conclude that you have depression and it's because of a chemical imbalance is a fallacious conclusion. A more workable approach is to consider neurotransmitter modification in conjunction with the larger holistic picture. Perhaps as you would Tylenol for a fever, while you investigate and treat the underlying infection. Oftentimes, there's a complex mix of these factors influencing your experience. Through an integrative psychiatry lens, we conduct a thorough examination of underlying causes and contributing factors through inquiry and labs and diagnostics. As these underlying causes and contributing factors are identified, we guide you through personalized treatment considerations that will meet your specific needs. We want to help you get to the root of your experiences. Imagine all of this coming together in a tapestry that represents your life experiences. We tend to name the overall impression with a descriptive diagnosis like depression. However, when you look closer, you'll find knots among the fibers, representing the internal and external environmental contributions. Releasing these knots changes the structure of the overall tapestry. Integrative psychiatry includes the incorporation of several treatment options tailored to your specific needs and interests. The main categories include medications, nutraceuticals, which are herbals and botanicals, bodily-based treatments, lifestyle modification, therapy, and additional treatments. Rather than a one-size-fits-all approach, it's important to ensure that the treatment aligns with not only your symptomatic experience, but also with what's going on in the remainder of your internal and external environment. There are several pharmaceutical agents used in the treatment of depression, some of which include the following: selective serotonin reuptake inhibitors, or SSRIs, serotonin norepinephrine reuptake inhibitors, or SNRIs, norepinephrine dopamine reuptake inhibitors, or NDRIs, and second-generation antipsychotics, or SGAs. There are also several other adjunctive agents and a few additional categories of medications not commonly used as much now. Nutraceuticals often have ancillary features that support specific systems. For example, curcumin can help with depression, but is also anti-inflammatory. SAMe functions similarly to bupropion or Wellbutrin, but also supports methylation. Rhodiola has antidepressant properties, but also helps to balance cortisol activity in the context of adrenal impairment. Some additional options commonly used include saffron, 5-HTP, L-methylfolate, and St. John's wort, among others. The brain and body are not separate entities. In integrative psychiatry, we explore and treat causes and contributing factors in various systems for a more personalized and holistic approach to treatment. For example, mitochondrial impairment may be contributing to low energy and fatigue, and mitochondrial support may be an appropriate treatment to include to help with depressive symptoms. Inflammation will not only contribute to depressive symptoms by shunting serotonin and dampening the body's responsiveness to dopamine, but it will also impair the effectiveness of SSRIs. Cofactors such as vitamin D and iron are necessary at specific quantities for adequate serotonin, dopamine, and norepinephrine synthesis. These are just some examples of what may be included based on an examination of systems. Exploring the interface between you and the external environment is a key consideration. This may include lifestyle-related modifications such as sleep-related changes, exercise adjustments, dietary modifications, among other things. For example, if an individual is highly inflamed and experiencing depression, and they consume high amounts of added sugar, specific recommendations to balance the way the body handles the sugar intake, in addition to focusing on the depression and immune system, may be considered. It may not be just a matter of eliminating sugar intake, rather the appropriate direction comes from seeing the bigger picture. Therapy approaches help to develop strategies and techniques to influence your experiences and/or involves depth-oriented work to get to the root causes of symptoms. Common modalities used in the treatment of depression include cognitive behavioral therapy, dialectical behavioral therapy, psychodynamic psychotherapy, positive psychotherapy, and solution-focused or problem-solving therapy, among others. While there are several psychotherapy modalities used for depression, at the core is the relationship between the individual and therapist. Some additional treatments include the following: transcranial magnetic stimulation, or TMS, and electroconvulsive therapy, or ECT. Psychedelic-assisted therapy is another approach to depressive symptoms. This is commonly facilitated by ketamine in various forms. Several studies out of Johns Hopkins surrounding the use of psilocybin for depression have been promising. Thank you for listening to this presentation. For more detail beyond this general overview, check out the blog linked below, where you'll also find some helpful downloadable content.